All right, guys. As many of you know, there are two pandemics going on at this current time. Of course, everybody knows about the COVID pandemic that is striking the world, really. However, there is also the opioid crisis that is going on, as the CDC has even acknowledged that overdose deaths have increased since the beginning of COVID. Hulu, the streaming channel, has a TV show about the beginnings of the opioid crisis called DOPESICK. So the opioid crisis is definitely something that is acknowledged, and it is something that is even acknowledged in the nursing world, unfortunately, as it seems that more and more nurses are, stealing or taking, or whatever it may be, medication from their patients that is typically used for pain killing. The opioids that patients should be getting have now been being stolen by their nurses. Yes, this is happening, and yes, it can happen. Everything is counted in nursing, as everybody should know, or will know if you are getting into nursing. Everything is counted, and you will eventually be caught. However, that has not stopped many nurses from, taking the medications that are used to kill pain from their patients. That's right. As sad as it is, many nurses have started doing this. True story, my very first charge nurse was actually found dead in a Taco Bell bathroom from an overdose. Yes, that is actually a true story. It can happen to anyone, something that a lot of people seem to neglect. Of course, I work in substance abuse, so I sort of understand this. Anyone can fall victim to this opioid crisis, much like the COVID pandemic. Anyone can really, all of a sudden, fall victim to this opioid crisis, and nursing is run by people, and people can be sucked into this opioid pandemic, and it has sucked in nurses. It's quite unfortunate. Of course, we are all in this to do no harm first, and many of us get into it to do no harm. No one gets into nursing thinking, I'm going to take all of my patients' medications. However, us being people and us having our own vices that we do have, the opioid crisis striking really anyone, nurses have now found themselves taking medication from the patients. This is a terrible situation. It's a terrible thing, the entire opioid crisis. However, nurses, people that you trust, taking your medication as a patient is a terrible thing to begin with. And, it's just not a good situation all the way around. I personally don't really like seeing it. I don't like hearing about it. I don't really care to hear nurses taking medication. I am fully aware that it happens. It's been happening, since before the opioid pandemic. It's actually happened, for years. I had a colleague tell me, who was much older than myself, that when she very first got into nursing, she learned the hard way to be sure you put eyes on what you sign off on, as she found her colleague taking medication from another patient after she had signed off that she verified that med was wasted. She said she had to go in front of the nursing board for that one. So it was a terrible situation for her as well. I don't like seeing this. I don't like seeing nurses taking medications from patients. And of course, like I said, I am in substance abuse. That's the area of nursing that I am in. And I am going to tell you that anyone can fall victim to substance abuse. I've seen all walks of life that fall victim to substance abuse, and there's definitely a stigma about it, and no one really wants to, especially, the nurses, they don't really want to mention it, but it does happen, and it is a terrible situation. And if you feel that you might be getting into this, you need to let someone know and get yourself some help before anything bad does happen, as, anyone can fall victim to the opioid crisis, including these nurses. Yes, these are nurses that fell victim to this pandemic as well. Terrible situation, terrible for the patients, terrible for the nurses, honestly terrible for the families, both sides involved, because you know that the patient's family is just furious at the nurse, and the nurse's family may not know what to do. You know, they may not know next steps. Terrible situations all the way around, and I personally hate seeing it. I just do. It's hard to look at, especially for myself, probably for other people as well, as some people can relate. As I said before, my very first charge nurse was found dead in a Taco Bell bathroom. Sort of hits home when I see things like this. I don't like seeing it, and we need to educate each other and hold each other accountable so that nothing like this happens, so that we can prevent this, so that we can keep this from happening. I hate seeing it. On a depressing note, that's all I got for you today. If you like this video, check this one out over here. Don't forget to like, share, and subscribe over there. And if you like Nurses Making the News on Thursday, there should be a playlist down below. I hope it helps. Thank you so very much.